Welcome to Behind the Beauty, the North Texas Plastic Surgery Podcast. This is Season 1, Episode 4, and I'm your host, Dr. Sasha Obaid. I'm joined today by a very special guest, Dr. Jeremy Bosworth. For those of y'all that don't know Dr. Bosworth is currently finishing up his aesthetic fellowship here at North Texas Plastic Surgery and is set to join us full time starting in July. Congratulations, Dr. Bosworth.
Thank you very much.
Dr. Bosworth, like myself, grew up in Southern California, but thank God we have both gotten here to Texas to stay. Dr. Bosworth went to Thousand Oaks High School in Southern California, where he was a fantastic athlete, starring in two sports, both football and hockey. He continued that hockey passion all the way through college and then moved on to medical school, ultimately training in general surgery in New York before moving down to Alabama for his plastic surgery training. And then the coup de grace, of course, his fellowship with us at North Texas Plastic Surgery. So as we get ready, welcome, first of all, Dr. Bosworth.
Thank you. This is fun. Thanks for having me.
Awesome. As we get set to dive into our topic today, which is plastic surgery for the fit, I think it's really important that we kind of start by realizing that each of us has a natural passion and a natural thing that we're drawn to in plastic surgery. For me personally, I am, as many of y'all know, father of 6, married to the beautiful Dr. Deborah Obaid. As a father of 6, I'm really passionate about the transformation that mothers go through with pregnancy. And so you will see a lot of the content that I produce dedicated to helping moms get their bodies back after childbirth. All that being said, Dr. Bosworth, who, as I mentioned, has a long and illustrious, can I say that, athletic career.
That's very generous, yes.
Dr. Bosworth is a real fitness aficionado. And I think it's safe to say, Dr. Bosworth, that one of your real passions in the plastic surgery field is plastic surgery for the fit. Is that right?
Yeah, absolutely. I mean, growing up my whole life playing sports, being in the gym, trying to stay in shape the best that I can. I've been around that kind of group of people, and I think that there's just kind of questions that are unanswered. People want things, but they don't know how we can help them. And I really enjoy helping those people. Maybe not. I love doing these big transformations that we do.
Mm-hmm.
They're amazing. They're life-changing for these people. But then there's this group of people that doesn't necessarily want or need that big transformation, but they want something done and some sort of transformation. And those are amazing transformations too. But they're just a little bit more subtle maybe, or they're more harmonious with the person's current body that they've worked hard to get.
It's funny. I think it's the ultimate in irony, right? You said something there, and I think that I want to kind of circle back to, which is when people are fit, sometimes the world believes that they don't need to do anything more. They don't need to do anything else. But the ultimate in irony is what helped create that fitness was a drive to be the best that they can be. And just because they are in the top 5, 10, or even 1% of fitness world doesn't mean that they stop caring and they just accept these imperfections in their bodies. Ironically for them, they may actually be bothered more by these little things, air quotes little, than their counterparts who are out of shape.
Right. Yeah. I mean, there's things on our bodies that, one, no amount of healthy diet or going to the gym and working out are going to be able to be fixed by those things. Loose skin that you may have gotten during pregnancy, or from weight gain, weight loss, stubborn areas of fat that, we all have that, maybe is more in others. And some people are more bothered by that. And there's just smaller breasts in women who want a little bit larger breasts. There's things like that that we can help with surgery, that just no amount of gym or diet is gonna help.
And I think that what would be helpful for our listeners is for us to kind of just run through what are the challenges that someone who, like yourself, is really fit, really athletic, what are some of the challenges that they face that maybe the rest of the world doesn't realize? And what are the things that we can do specifically as plastic surgeons to help that fit patient? And so if we talk about guys who are really fit and we talk about the chest area specifically, one of the things, as you know, that's a real challenge is gynecomastia. So tell me a little bit about gynecomastia and why that's such a problem for bodybuilding men.
Yeah, so it's really the medical term for male breasts, essentially, or the appearance of a male breast, or appearance of a feminine chest on a male. And what it can be caused from is multiple things, like enlarged gland. We all have some type of gland in our chest. Some males are larger, more firm, and that can give the appearance of a more puffy nipple. And that can really bother guys. And when they're in a shirt, that can show through the shirt. When they're at the beach or the pool in a bathing suit, they don't like the way it looks. And there can also be excess fat in the chest that can give a more breast-like appearance. And those are things that we can address with surgery.
Yeah, and that puffy nipple thing, like you're talking about, it's really accentuated in guys who are in fantastic shape. Because what happens is when you get that body fat way, 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 way down, you lose all of the fat in the chest area. You can see the pectoralis well developed, but the problem is that little nubbin of breast tissue that you are essentially born and cursed with sits right behind that nipple, and on that really well-developed chest, all of a sudden it's this thing that's just kind of poking out at you.
Yeah.
So what do we do to fix that?
So depending on how extreme it is about what the patient has, there's multiple things we can do. Nowadays we've got a lot of good technology that can really help us be less invasive than we used to have to be in order to take care of this. The kind of heart of it all is just cutting the gland out. Small incision in the areola that hides really well. Go in, take that gland out. But now we've got technology such as Vaser, which is ultra.
So if I can interrupt for one second, for the uninitiated, when we talk about areola, we're basically talking about the colored part of the nipple, right?
Correct.
And so you can actually cut that little nubbin of tissue out without a visible scar, which is critical for these guys whose chests are so well developed. They want to go to the beach. They want to go shirtless, and they don't want anyone to know they had surgery.
Right. Yeah, exactly. So we can cut it out. Essentially no scarless. Now everybody, of course, scars differently, but we can hide the scar very well in that colored pigmented skin of the areola. And in addition to that, sometimes we can do a little bit of liposuction to kind of shape the chest, highlight and enhance the underlying muscle that's already there. And sometimes we can get away with just liposuction. Now that we have technology such as ultrasonic technology to help us with
that ultrasound assisted lipo, I think you're talking about the Vaser.
Correct.
Why is that so important?
Well, some of this tissue that's in the chest is very dense and firm, so it can help us get through that tissue. And it also is a lot safer liposuction, and it helps us break through the fatty tissue and break it apart. And it targets the fat without having an effect on the blood vessels. So we can do a lot safer liposuction with a lot less blood loss now.
Fantastic. I think one thing that's also important to mention as we talk about that gynecomastia, I think it's important that guys know what are some of the things that they are doing or may have done in the past that's contributed to the development of it, so that they're not repeating the same mistakes.
Yeah.
So I think that there are a couple of things. Number one, obviously in the fitness world, steroids, right?
Oh, yeah.
And so, if you've used steroids in the past or if you're currently using them, that can certainly accentuate that gynecomastia. In addition, there's guys who aren't necessarily taking steroids, but as you know, testosterone replacement is huge in guys, especially our age now. there seems to be a low T type center, not to single out one institution, but just a low testosterone type center on almost every corner.
Right.
And what people don't realize is that testosterone that they're taking, in some men, the body can actually convert that to estrogen, which can cause hypertrophy of the breast tissue. Right. And that can create a problem. And then, of course, the other thing is marijuana use, right? And so I think it's important for guys who are struggling with this issue, not only that we consider the surgical options, but they also think about what are the factors in their lifestyle that are contributing to it, specifically steroid use, testosterone replacement, and also marijuana use.
Yeah, I mean, I think, stopping or slowing down on these things that are reversible causes may not make it so you don't need the surgery, but it can make your results better in the end and then last a whole lot longer.
Yeah. So shifting gears a little bit, moving down the body, we start talking about the core. What are the real challenges that you see in the male core in the fitness world?
Yeah, so a couple different areas that, guys have trouble with. Loose skin, first off. If you were heavier at one time and lost some weight, you get that loose skin, stretch marks maybe, and there's just nothing you can do once your skin has lost elasticity to rebound itself. So really, there's a couple things we can do. If it's just minimal, we can do a little bit of liposuction with some skin tightening technology, like a body tight type technology, and that can have some effect on the tightening of the skin. The other thing is, and that's most effective, is cut it out, excisional surgery or a tummy tuck, and we of course have different variations of that.
Mm-hmm. So how often, and it's interesting you mentioned tummy tuck with guys, how often do you think guys need tummy tucks, and how would a guy know if he needs a tummy tuck?
Obviously, the female population is a lot larger part of our patients, at least at our practice. Mm-hmm. But guys have the same problem.
Well, I think in general it is too, right? Because there's this whole childbirth thing, right?
Right. Yeah. So
sorry, go ahead.
Yeah, no, totally true. But if you've got skin that's hanging over and it bothers you, if you've got stretch marks, that's an indication that your body is just really probably not going to rebound that skin on its own. If your skin is bothering you, it's hanging over, you might be a candidate you probably are a candidate for tummy tuck surgery. But in addition to the skin, if you've had that weight gain, your core may be weakened by some separation of the muscles too. It happens more in women because of the pregnancy thing. But in guys who have had a lot of weight gain and weight loss, their muscles can also be separated, and we can bring those back together with surgery.
And the other thing, I think, in addition, obviously, to removing the skin, that can be an issue in the core in men. While I'm not certainly the athlete of some of the people that you're talking about, I know for a lot of guys like myself, I just can't lose that little bit of fat in the love handle area. Yeah. No matter how much I work out.
Yeah. Yeah. That's probably the most common stubborn fat area that we see, men and women. And it's, you can be in the gym doing cardio, eating right, and there's just that area kind of in your posterior, flank love handle area that just doesn't go away, and it can really bother people. It can affect their shape and in clothes, out of clothes, and it can also affect how their ability to perform. I had a patient, really great story, lost a ton of weight. He was very overweight, became a triathlete, not just like not just to do a triathlete, check that box, like a competitive triathlete after losing tons of weight. But he came to me because he was bothered by that stubborn fat, because when he would do these long distance runs, he could feel it and it was really bothersome to him and it was affecting his performance. So he came to me and we were able to help him with some liposuction, some skin tightening. And he's thriving now, loving life, loving his new body.
I think probably the final area we really have to talk about when we were talking about the fit men and the core is we really got to talk about the buttocks. So what issues are guys seeing in the butts, and how can we fix that?
Yeah, I mean, as guys get in shape, maybe they're a little bit heavier, and then got in shape. Again, that loose skin, kind of a sagging of the buttocks, or just don't have the shape that they had when they were younger, maybe. And there's things we can do, and guys maybe don't want to think about this or talk about this or admit that they are interested in it, but we can do some fat transfer to the buttocks, and that doesn't mean they're going to have some big booty. It just means that we can bring back kind of that more youthful, lifted, athletic shape that they had or that they want.
Yeah, it's super frustrating for some guys because, obviously life takes you in different directions. You gain weight, you lose weight, but then you finally commit to getting in shape and you start losing weight like crazy. And despite losing all that weight, it sort of loses asymmetrically. So you'll have some guys that actually preferentially lose the fat in their buttocks, but keep it in the love handles and the waist area. And so they end up with this upside down look to their buttocks and to their backside. And we can really flip the script on that by actually taking the fat from above, putting it down below. And again, like you said, not trying to make a man look like Kim Kardashian necessarily, but rather just trying to give them a normal fit, rounded appearing buttocks.
Right. Yeah. Because the rest of the body can be very trim if we're taking care of the love handles, whatever we're doing above. But if then they have this kind of saggy old man butt, it may not fit.
I'm going to go home tonight and look at my buttocks in the mirror, try to get a second mirror to kind of get that look, make sure I don't have an old man buttocks.
That's right.
I love it, Dr. Bosworth. So let's kind of switch gears a little bit and talk about the ladies and our fit ladies specifically. Yeah. Before we dive into the effects of pregnancy on women, just super fit, never had children, women, what kind of challenges do they face when they talk about their chest?
Well, there's genetics. Women who may have smaller breasts and desire larger breasts. Some women are happy with their smaller breasts. That's great. But some women would like a little bit larger breasts, maybe a lot larger breasts. But I kind of think in the population we're talking about is more something that's, like I said, harmonious with their body, that they're going to still have that athletic fit look, that's going to look natural, still going to allow them to do all the things that they're doing to stay in shape and not be affected by that and not have some gigantic chest that is going to get in the way. And, we can do that. Absolutely.
And I think that one of the things that is frustrating is, we talked about in guys how they can get really fit, but they have this sort of little nubbin of glandular tissue that causes that nipple puffiness, etc. We can run into a similar but the opposite problem in women where you get so fit that you lose the vast majority of your breast tissue, because ultimately, even in the female breast, the vast majority of the volume of the breast is fat. And so a woman who gets really fitness competition ready has almost zero breast tissue. And so really the only way for a lot of those women to maintain their athletic look, but also have that feminine appearance, is with a breast implant.
Yeah.
And so, as you mentioned, we can obviously size them differently, right? So there's a look that obviously some women want that's a very voluptuous, feminine appearance, but then there's also just feminizing the athletic female as well with a more modest size implant. It's someone that looks fit, but not necessarily voluptuous. So like you said, you can use smaller implants.
Yeah.
Talk to me a little bit about implant placement in those patients, because there's that big debate between now in the fitness competitor, do we go over the muscle or under the muscle with our augmentation? What do you think?
Right. So it is a big debate. And, I would say the majority of the implants we place are under the muscle, and that works for 99 at least percent of the population, even the athletic fit ones, CrossFit, whatever they're doing. They will lose little to no strength from their pec muscles. and it will look great. The pec muscle, going under the pec muscle, allows it to have a more natural look sometimes, and there is benefits to it from capsular contracture or the tight scarring and things like that. But not everybody either wants that look, or they're just so lean not so lean, but they are so into the bodybuilding that they may have problems like animation deformity if you put it under the muscle. Or the muscles are so strong, and that's kind of where when they flex the implant, you can see the implant moving, and it can look funny, it can feel funny. In that small percentage of the population, over the muscle may be a better option for them, and it's something that we would just talk about when we see these patients come in consultation with us, and determine what's best for them.
Yeah, I think that it's a case by case basis, really. When we talk about putting the implants over the muscle, that's a great option for obviously preserving the strength of the pectoralis muscle. The issue can be that in these very fit patients, because there's almost no body fat, then there's nothing covering the implant except skin. And then it can look very unnatural from that perspective. So we have to be a little bit careful between those two. On the flip side of it, as you mentioned, especially if not done well, you can get a little bit of motion to the pectoralis muscle over and under the muscle implant. And that's what we call that animation deformity. And if you, I'm sure our really fit women have girlfriends at the gym that complain that when they flex the pec, the implant moves or the pec jumps in a funny way. There is a fix for that, believe it or not. And as Dr. Bosworth mentioned, that is to shift it to an over the muscle location. I know you've done that on a few patients, had some great results with that.
Right. Yeah, I mean, we can still get a really good look, and it really just depends on the goals and kind of the aesthetics and the lifestyle of the patient.
So obviously now we talked about the nulliparous, or the woman that's never had children, fit person that's wanting some breast enhancement. What are the challenges for the fit mommy when it comes to the breast?
Yeah, so fit and not fit. If a woman who had a large breast initially and maybe got in shape, or a woman who was pregnant and was breastfeeding, their breasts stretch, the skin can similar to the tummy, the skin can become thinner and not rebound as well, so they can get a lot more sagging to the breast, and in those situations we can do things to kind of reshape the breast and resuspend and lift the breasts up, in addition to an implant or without an implant.
Yeah, I think one of the challenges, right, is that when we talk about breasts that are beautiful, they're perky, right? And everyone is scared of the sagging breast. And we always say, what causes a breast to sag? And really, it's an asymmetry between the amount of skin and the amount of volume that you have in the breast. So for our patients who were moms at one point, they have, well, I guess they're still moms, but were pregnant at one point. The hormones of pregnancy, whether you choose to breastfeed or not, causes an expansion in the breast tissue itself, right? Which causes the breast to get bigger, which then stretches the skin. The problem is that then they go and get fit afterwards. That breast tissue and fat goes away. And now you have a large skin volume for a very small volume of breast. And so very often we can fix that obviously with doing a breast lift, but sometimes we can actually fix it by just adding an implant. Is that right?
Sure. Yeah, absolutely. Just an implant. I don't want to say that it will lift the breast, but it'll fill out that skin envelope like it used to be. And it can we can get a great shape out of that often.
So moms not only obviously struggle in the breast area oftentimes when they get fit, but they can also have some challenges when it comes to the core in getting fit after pregnancy. What are the challenges that you see in a lot of moms with that?
Yeah, I kind of touched on it with the guys, but it's really common in women who have been pregnant. As the baby is growing, the abdominal muscles, or the rectus abdominis, they're held together by a tissue, and that can stretch. And when the baby is gone or the weight has come off, you know, the muscles may slowly go back, but that tissue that is stretched is called a diastasis, or a separation of the muscles. And what that does is it makes your core, which is your abdominal muscles, not in an anatomical position, and a lot harder for them to do the work that they're intended to do.
Yeah. So, kind of putting it simply for all of our bodybuilders that are out there, think of your rectus abdominis, your six-pack abs, right? What people don't realize is that muscle fibers only contract in one direction. So they contract either up and down or side to side. The rectus abdominis, or six-pack muscles, they're oriented up and down. And what happens with pregnancy is that growing uterus pushes against that six-pack, takes the six-pack and turns it into 2 3-packs. And the problem is that you can go hog wild on core exercises and you can contract the rectus up and down, but because they don't contract side to side, you end up with that space in the middle there, and that creates that pooch, no matter how strong you are. And I think you touched on something even more important than that, is that not only does it create that pooch, but it also makes the muscle inefficient. And so it becomes really hard for your core to get strong. So when you want to go back to working out, lifting, yoga, etc., it's really hard because the muscles are literally not in the right place to do the exercises that you want to do. So how do we fix that?
You know, it's a tough situation because there's nothing that you can do in the gym to get those muscles back together. We've got some surgical options that we can do. You know, if you've got minimal excess skin, we can do some like a mini tummy tuck. And that's really a small incision tummy tuck where we can cut out a little bit of excess skin, mostly below the belly button. But it allows us to go in there, see the muscle separation, and fix it, bring it back to its anatomical position, which brings the core strength back to what it was before.
Yeah, I think it's really important that we emphasize that it's actually the repair of the muscles in the mini tummy tuck that is the magic of the operation. It's not the skin removal. So, you know, I can't tell you how many women that I've seen over the years, super fit, okay? They've had children and they have that separation. But they've gone crazy in the gym. They've lost everything. And there's actually almost no extra skin, so that you look at them or they come in and they say, oh, I certainly don't need a tummy tuck, but I need something to look better. And the reality is that mini tummy tuck is perfect for that, because we can actually repair those muscles, get them oriented in the right direction, get your core zipped up, and get you doing down dog again without something hanging down there.
Right. Yeah. I mean, we could take out every ounce of fat and every extra bit of loose skin on you. But if that core, or if those ab muscles are not back to their anatomical position, you're still going to have that pooch. Some women come in complaining that they still look pregnant, and you know, they had their child a long time ago. And that's just simply because of that separation of the muscles that we got to go in there and fix.
And, you know, once we fix those muscles, I think it's important to also emphasize that a female athletic core looks different than someone that's just had a regular old tummy tuck. So what are you doing, Dr. Bosworth? Because I know you're doing a lot of these sort of fit mommy transformations. What are you doing to kind of make that tummy look not just skinny, but actually athletic?
Yeah. And I really love this part of the surgery, because I've seen tons, and people come to me or anybody at our practice and they've had a tummy tuck somewhere else. And, you know, they may have just had, you know, someone just came and pulled the skin down, got rid of all that excess skin, but they just look flat, and with no definition at all. So oftentimes with our tummy tuck, we will add in some liposuction to really kind of highlight the natural hills and valleys that a fit abdomen has. That doesn't mean we're carving abs into somebody that aren't really there.
No, we don't want to look like a Teenage Mutant Ninja Turtle, right?
Exactly.
Sorry.
We are just highlighting what the patients already have.
Yeah.
And, not just giving them a totally flat surgical looking, honestly, abdomen, but we make it look natural and fit and really, a nice appearing tummy.
Yeah, we want to have those hills and valleys of those six-pack abs, of the rectus muscles, right?
Right.
I think that's super important. And I've seen you highlight them in your tummy tuck and your liposuction cases. And I've also seen you do a couple of, like you said, these patients that have had tummy tucks done somewhere else. They come in with that surgically flat appearing stomach that doesn't look fit at all.
Right.
And you've created those hills and valleys to make that athletic waist.
Yeah, I think it's super important. It's not just about getting rid of the skin and making things as flat as possible. That's, it's really about making it look natural and fit with the patient's body. And so when they go out and wear their bathing suit or whatever, clothes they're going to wear, they just look like themselves, but a nice version of themselves.
One of the things is, after you kind of sculpt the core and you got everything right, one of the other areas that I see a lot of women struggle with is, especially the athletic women, is the hip area. So what are you doing in that area to kind of contour things and to help those really fit patients?
Right. So this is an area that is affected by kind of weight loss where, women tend to lose the weight in the hip areas and they get these, what we call hip dips. And they can affect the kind of overall shape of the patient. And what we can do is add a little bit of their own fat back into those areas, not to change their shape necessarily, but just to kind of give them a more definition and more kind of hourglass shape that is very feminine, but still fit looking.
Yeah, that's one of the real challenges. So when you talk about the hip area, whether it's man or women, the fat that causes that little roundness to the outside of the buttocks, or that little roundness to the outside of the buttocks, is not caused by muscle, it's caused by fat. And so most guys don't have a big fat pad there. And so you'll see, especially really athletic men, will actually have a depression in the outside of the hips. And the challenge can become for women that have that fat pad when they get super fit, which is really in vogue right now. They lose that fat pad and they get those hip dips, which makes them look masculine as opposed to feminine. And then fashion now, of course, accentuates that, right? Because you got to have the perfect yoga pant butt.
That's right.
And if you got these really fit, caved in hips, not so hot in the yoga pants.
Yeah.
Sorry.
And
so,
right. It's all about making the shape that's really just, smooth lines, not necessarily making these huge voluptuous butts or hips. It's the same thing for the fat transfer of the butt or the Brazilian butt lift. We do, we can make the butt as big as, we want, but we can also just make a nice athletic, plump, more firm and toned looking butt too with the fat.
Yeah. And I think ultimately making sure that while you are athletic, you still maintain that feminine appearance, right?
Yeah.
Well, Dr. Bosworth, I've really enjoyed kind of getting to visit with you today and talking about all of these specific challenges that affect men and women in the fitness world, maybe that aren't necessarily thought of when we think of plastic surgery. Thank you so much for your time. Anything you want to leave our patients with and our listeners with before we take off?
Yeah. No, thank you for having me. This was awesome. I had a great time. I look forward to doing more in the future, hopefully. And I think it's just important, don't be ashamed to come with questions. We're here. We're happy to provide the information. If there's something that you want changed, come see us and we can talk about if there's anything that we can do to help you out. And, as this podcast goes on, we're happy to, answer whatever questions you guys have, and just share the knowledge.
Yeah. And listen, if you're not ready to commit to coming in and visiting with us, jump on Dr. Bosworth's Instagram, Real Dr. Boz.
That's right.
DM him. Let them know. Say, hey, I'm super fit. I've got this little issue. Would love to talk to someone about it. We can do virtual consultations from the comfort of your own home. If you don't live here in the DFW area, Dr. Bosworth has a lot of patients that actually travel in for surgery with him. For some reason, you have a huge following in Colorado, I believe.
Yeah, I
do. You know, feel free to message us, message Dr. Bosworth. He'd be happy to talk about some of these struggles with you, and realize that just because the rest of the world thinks you're in fantastic shape doesn't mean that you should feel bad about wanting to take it to the next level.
Yeah.
So thank you again. Thank you, Dr. Bosworth.
Thank you.
And that's a wrap on Behind the Beauty on the North Texas Plastic Surgery Podcast, Season 1, Episode 4. Thank you.